Today I'm talking to Dr. Clare Gerada, former chair of the Royal College, champion for patients, and indeed today we're not talking to you as a doctor, Clare, but as a former patient. You've experienced the COVID-19. Tell us a little bit about it.
Yeah, I did, Domhnall. It seems a long time ago now, but a few days after I came back from New York, in fact 2 days after I came back, in the beginning of March, I developed, the first symptom was just a very high temperature. It sort of came from nowhere. But then the rest of the symptoms followed. So I had a new cough. In fact, my throat felt like it had glass in it. An unbelievable headache that there wasn't photophobia, but I certainly had to shield my eyes because the pain was just so intense. And after about 6 days, I was almost back to normal. I certainly felt very fatigued for another few days after that. And so I'm currently doing two main roles. One is running Practitioner Health, which is a confidential service for doctors and dentists with mental illness, and the other is a senior partner of my practice. If we look at Practitioner Health, well, we've had to change more or less everything we do. We're now, like the rest of the world, entirely a virtual service. We've had to put on more services. And if you visit our website, practitionerhealth.nhs.uk, so we've put on a doctor's common room twice a day, support groups every day, a peer support group, which we're working with the Royal College of GPs to do. And we've put on a whole host of other information, which you can access through our website. And we also now are eligible medical students and recently retired doctors, so we've expanded our service to include those. With respect to being a normal GP, well, hasn't everything changed? It's like we've concentrated, we've concertinaed 20 years of trying to get things done into 3 weeks. So we've moved, and I'm sure everybody else has moved from more or less 100% footfall to less than 1% footfall. So we've moved, if you think across England, 1.2 million consultations a day, and probably across the whole of England, we're seeing 10,000 patients per day face-to-face, if that. Imagine how that has changed. It's a sort of, the patients have taken this on board. If you think about what we've asked them to do, my only worry, Domhnall, is where has the normal general practice gone, the normal GP problems? I mean, but where's it all going? The breast lumps, the abnormal bleeding. And my worry is that we're going to see a big surge of problems maybe coming up in 6 to 8 weeks' time, which of course we're going to have to deal with.
Let me bring you back to our colleagues' health, because you have a very close eye on how our colleagues are doing health-wise.
I think, first of all, we have to say it's absolutely normal to feel anxious. And I think there is a sense that anxiety, somehow you're not resilient enough. But what we're also seeing is a new group, the sort of moral injury group of people that are ringing us up, people who are having to make decisions which they wouldn't have had to make even 6 weeks ago, who to call an ambulance for, who to direct and say they need to go to hospital. And those are difficult decisions. And we're also seeing our colleagues struggling with issues around end-of-life care. And I think the profession is struggling, just like everybody else, in making sense of what's going on. And at the same time, if you think about it, especially GPs are having to contain the anxiety of others. We've always been seen as the saviour and the scapegoat. I'm concerned that even now, people underestimate what we're doing. You know, you hear it constantly about intensive care being at the front line, when actually general practice is at the front line, because we're having to make those decisions that actually will influence the whole of the rest of the care pathway. I'm also concerned about the recently retired doctors coming back and working in 111. 111 is a very difficult place to work. And finally, I worry about my profession because we're not seen as the front line. So yet again, we're having to fight for our corner, fight for PPE, fight for recognition, fight for the volunteers, fight for recognition. And that's being transmitted, I think, to the mental health of GPs.